Welcome back. Happy Friday. If you like these videos and know anybody that might find them interesting, please feel free to pass these along to friends or colleagues and consider hitting that notification bell so you don't miss any uploads in the future. The best dentists that I know focus a lot on continuing education. My first year out, I didn't really know what to do. There were so many different avenues you can pursue. I wanted to get better at endo. I knew I wanted to learn to place implants. I wanted to learn some kind of comprehensive dentistry like full mouth reconstruction, stuff like that. I had all these interests and I had no idea where to start. The first big class I took was part 1 of the 7-part Dawson continuum. And the Dawson Academy is similar to the Pankey Institute or COIS or SPEAR. These kind of high quality continuing education groups that are honestly pretty expensive, they'll put together sort of a curriculum. And so, for example, in my case, the first class I took was part 1 of a 7-part curriculum, where at the end of it, you should be able to do full mouth reconstructions, understand how the jaw joint relates to the bite. There's a lot to that. And so my first class was just the very first part of that. And even though I do really none of that now, I don't do any full mouth reconstruction, I think that was the most valuable class that I have taken so far because it just kind of opened my eyes to a high quality level of dentistry that's out there that we really didn't get a chance to see in dental school. I really underestimated how much work it could be to do a full mouth reconstruction or to do a set of veneers. And by taking that first class, I really got a chance to see just how much dentistry could actually do in terms of treatment, especially for, like a full mouth reconstruction, something like that. Another great thing about those classes is they have such high standards when it comes to records. So their models are great, photos are beautiful. And being able to practice like that, even if it's like a small town dentist like me, if you have good models and good photos, it really just helps you provide better dentistry. Because if you get out of school and say, like in my case, I worked in public health, it's really easy to kind of get into a rut. And there's nothing wrong with that. There's nothing wrong with treating one tooth at a time or, something like that. But at the same time, just having an awareness of what's out there, it's kind of cool. It's empowering to know that if somebody came to me and said they wanted veneers, I'd be able to treatment plan it. I would be able to come up with a solution and really do it right. Another great thing with those classes is they focus really heavily on the jaw joint and occlusion because both of those things are incredibly important in daily dental practice. And even though we learn them academically, like years 1 and 2 of dental school, we don't really get a chance to kind of interact with them as much in clinic. I think the reason for that is we're doing sort of one thing at a time. And so we're doing, we want to do as many fillings as possible, as many crowns as we can. Dentures is kind of the one arena where you're kind of paying attention to occlusion. But for the most part, I pay attention to occlusion a lot more, even with like a single tooth filling than I would have in the past, sort of doing things the way that I did in dental school or even when I worked in public health. And it can be intimidating to go to those classes because if you're planning on going through like the 7 Dawson classes, it's probably going to cost, $30,000 or more when you factor in travel and hotel and things like that. But even if you take the first 1 or 2, I think I took 4 out of the 7 over the course of about 2 years. That was incredibly valuable because I learned how to take good records, I learned how to treatment plan well, and I kind of have a better understanding of just what goes into a big full mouth reconstruction type case, and I can use those principles in daily practice. That is one option that I think is great, is to start with one of those comprehensive type CE classes for just general dentistry. And I think that will make any dentist a better dentist. I honestly believe that. And I would encourage anybody to take it when you're early in your career, because if you take it now, then you will have, so many more years that you can apply that to your practice. And honestly, if you can't afford a class, you can get Pete Dawson's textbook. It's one of my favorite textbooks in dentistry. If you go through that chapter by chapter and really just kind of understand what the textbook is, you'll understand a lot of what goes into those classes. For me, it just opened my eyes to what was really possible in dentistry. Another option, and this is what I do now with continuing education, is to kind of pick an area that you really like or want to focus on and have a genuine interest in, and just go like 100% in that direction. So for me, that's orthodontics. I take almost exclusively orthodontic continuing education now. I'll pick and choose some little classes here and there, some little online seminars, but when it comes to the bulk of my continuing education, most of it is orthodontics and orthodontic study clubs. because I love ortho. And I've kind of learned that about myself, that if I'm going to get good at something, I have to kind of go all in on it rather than doing, dabble in ortho a little bit, dabble in implants a little bit. But like, if your thing's not ortho, if it's implants, you can take something called a maxi course. So the American Academy of Implant Dentistry offers a maxi course where you would go, it's like once a month over the course of about a year, like 4-day weekends that you're learning implant surgery, implant restoration. It's $20,000 or $30,000 when you factor in travel. But the dentists that come out of that are really generally pretty competent in implants. They're doing implant surgeries, they're doing sinus lifts. A lot of times they're doing grafts, they're doing a lot of stuff. And so if you really have like a heart for implants, a genuine, interest in that, you could kind of pursue that direction and just go down that road. Like, the fact that you're not doing ortho at all, it doesn't make you less of a dentist. I think it actually makes you a little bit more, because I would rather be an incredibly good implantologist and okay at everything else than try to be, do implants and do all my own molar root canals and that sort of thing, because it's so hard to spread yourself in those directions. And I mentioned the super GP in another video. They're out there, the super general practitioner, but for most of us, the reality is if we want to be good, we kind of have to pick a focus. And like I said, for me, that's orthodontics. For you, that might be implants. Honestly, for you, that might be just sort of all around general dentistry. If you're interested in that sort of all around general dentistry, the Academy of General Dentistry is a great organization. So if you've ever seen a dentist that has that MAGD after their name, or the FAGD, that's a fellowship of the Academy of General Dentistry, or a master, I believe, of the Academy of General Dentistry. What that is, it's just a variety of continuing education. So you have to take so many classes in surgery, so many classes in pain control, so many classes in endo, and then there's actually a test that you have to pass to get these certifications. And a lot of the dentists that I know that are kind of that jack of all trades, like really good at a lot of different things, they've got either their master's or their fellowship in the Academy of General Dentistry. My whole point to that is I think it's really good to have some kind of goal, because it's easy to just kind of pick and choose seminars or take quizzes online and get your CE that way. And that could be fun, but early in your career, like if you have an interest, I would say go for it. That's the one cool thing about being a dentist, where, if you're a general practice doctor that has an interest in dermatology, there's really not a whole lot you can do to kind of pursue that. But in dentistry, it's not like that. If you're a general dentist and you have like a really big interest in endo, you can get really good at endo. I know general dentists that do endo to the level of an endodontist. Honestly, the best implantologists that I have seen are general dentists, and they do it to an incredibly high standards. And these are people that started as a general dentist. And so if you have a goal, a passion, I would say definitely look into that and see if it's for you. For me, I actually started an implant course and I liked it. I got to place an implant. It was a 3-day course. We placed an implant at the end. And that was really great, because even though you can learn a lot from a seminar, by having us actually place a single implant at the end of that course, it really sort of upped your confidence level. So for a while, I was placing a fair amount of implants, about one a month. Recently, I've slowed down on that a little bit because, like I said, I've kind of pivoted and really gone in on ortho, and the implant surgeons that I work with are really great. And so we've kind of got a system down, and it's just more efficient that way. But if something comes in that's sort of a slam dunk, an upper premolar that I can graft and I can place the implant, I'll still do it. And, who knows, maybe someday I'll do some more CE and get more into implants and a little more aggressive. But for right now, like I said, I'm kind of happy where I'm at with implants, and I'm sort of pursuing that ortho direction right now. You're probably sitting here thinking, yeah, that's great. I just graduated with $450,000 in debt. I don't have $30,000 to learn how to place implants. And I totally get that. Like, if you want to take that first Dawson class and you don't have the $3,000 or $4,000 it's going to take to pay for the class and travel and hotel, buy his textbook. His textbook is awesome, and it's a great way to get started. And the same thing with implants. Buy Carl Misch's textbook and reach out to surgeons in your area. One of my oral surgeons actually flat out told me that you should be placing implants because some of these are fairly straightforward. Why don't you come to my office? I'll kind of show you how easy this can be. You can see if it's something you want to do. Usually if you reach out, there's opportunities for mentorship and things like that. And I sort of saved the best for last on purpose with this video. One of my favorite resources in dentistry is a website called Dentaltown. It's dentaltown.com. If you're on Dentaltown, you know exactly what I'm talking about. But if you're not, it's almost like a social media site, but it's much better. It's a forum where dentists from around the world, some really heavy hitters, some big names in the industry, kind of talk back and forth. Students are asking questions, dentists are asking questions, and It's just a great resource for dentists. Even if you just go on there and read and browse the topics and just see what people are saying. They also offer CE classes, and I've taken several. I think they might even be free to students. I don't know if they are anymore, but even when they're not, I think a course is typically, 36 bucks for a 2-hour course, something like that. But there's some really great ones in there. And so that could be another avenue to go if you don't have, the 5,000 bucks to drop on a big CE class right now. You can still get some really good information. No, I have no affiliation financially with Dentaltown. They're not paying me to say anything. I really just think it's that great. And I really think that if you are like new in your dental career, you haven't checked it out yet, or even a dental student, you can learn a lot just by kind of seeing the way other people do things and, the way just dentistry works in the real world. If you've taken any great CE classes before, leave them down in the comments. I might in the future kind of share specifically some classes that I did. I took, like I said, I took 4 out of the 7 Dawson curriculum classes. I took an implant course. Now, in terms of return on investment, I think my orthodontic course was right at the top. And I'll say this because it needs to be said. There is so much bad orthodontic information out there for general practitioners that I would almost encourage you to be immediately skeptical of anyone that wants to teach you braces. You should probably spend at least 40 or 60 didactic hours before you attempt orthodontics. And it's not a popular thing to say because so many people go to the weekend Invisalign course and think you're going to treat cases on day one. And I get that. I know people who have done it, but I also know people who have had trouble with it. And orthodontics is a lot more complicated. So if you get a postcard that says you can treat complicated cases after a 3-day course, I love orthodontics so much. I really want to do a couple more videos on that specifically because you really don't learn much about it in dental school. And like I said, there's a lot of bad information out there. And so even if it's just for general practitioners to kind of get a sense of what your orthodontist is going to do, when do you want to refer, and sort of being able to see that might be really helpful for people. I don't know. Hope that was helpful. If you have any specific recommendations for continuing education or something that like you've taken and it was really good, please drop it down in the comments. I would love to read that. Right now, like I said, I'm focusing completely on orthodontics, but my next thing that I want to incorporate is endo, because that's something that we have a tremendous need for. And sometimes my endodontist can't get people in for a week and they're in pain. And so that's a skill set that I feel like I really need to start incorporating into my practice a little bit more. So that's my plan in the future, is to focus a little bit more on endo and get better at that. I don't know. What do you guys think? What do you want to learn? Drop it down in the comments, and I will see you guys next time.